Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Annie Rogers, and on behalf of the Attitude team, I'd like to welcome you all to today's ADHD Experts broadcast. We are extremely pleased to welcome Dr. Kathleen Nadeau for today's webinar on ADHD in older adults, which is a truly fascinating and critically important topic. Though ADHD is the fourth most common psychiatric condition among adults, the fact is that few psychiatrists, neurologists, and psychologists are trained adequately in how to recognize, diagnose, and treat midlife or late life ADHD. As a result, older adults may be misdiagnosed, things like dementia, and may never receive the support that they need to thrive. So we're so honored to have Dr. Kathleen Nadeau. She's the founder and clinical director of the Chesapeake Center, ADHD Learning and Behavioral Health, which is in Bethesda, Maryland, one of the largest private ADHD specialty clinics in the United States. She is the recipient of the Chad Hall of Fame Award for her work in collaboration with Dr. Patricia Quinn on girls and women with ADHD. She's the author of more than a dozen books on ADHD and is a frequent lecturer nationally and internationally. Her upcoming book is called Still Distracted After All These Years, so appropriate for today. So before we get started, before I turn over the microphone, I just wanted to get just a few housekeeping items out of the way. Those of you who are here live, tuned into the webinar, you may download the slides now by clicking on the Event Resources section of your webinar screen. If you are interested in the certificate of attendance option for this webinar, please keep an eye out for instructions that will come in an email about an hour after the live broadcast wraps up. And for those of you who are listening in replay or podcast mode, please visit the webinar replay page at attitudemag.com/podcast-331. There you can access the slides and the certificate of attendance option. So now that we have all of that out of the way, I am very pleased to hand over the microphone to Kathleen Nadeau and this great topic of ADHD in older adults. Thank you so much for joining us today.
Well, thank you so much for having me, and I am delighted to be here. I mean, this focus on older adults has been one of the most important focuses of my professional career for at least the past 5 years. And there are only a few of us in the country that are really writing about, lecturing about older adults. For those of you that don't know it, Attitude also hosted a webinar by Dr. David Goodman. He's a longtime friend and colleague of mine. And nearby, we've actually worked with some of the same people over the years. And he's given an excellent talk on treating older adults with ADHD. So there are not very many of us. And my goal, and that's why I'm so delighted to be here today, is to really raise awareness of this issue so that there's more writing, more research. I've been working on a book for the past 3 years now. I interviewed more than 150 adults that were age 60 and over. And although this is not any kind of a formal research project, I did want to formalize it to a certain extent. So everyone that I interviewed had previously been diagnosed with ADHD by a mental health professional. I wanted to make sure that I really was talking to people who have ADHD, not those who just think they have ADHD. And my goal, as always, I mean, throughout my long career, I have really tried to look at who's getting ignored, who's getting overlooked, and what can we do about it. And so in my introduction, there was a mention that I worked with Dr. Patricia Quinn, and she and I did research for a long time, did a lot of writing about girls and women with ADHD because they were the hugely overlooked population. And now here we are. And I am among the oldest of the baby boomers, but baby boomers are turning over at the rate of 10,000 a day here in the U.S., maybe a little more than that, into retirement years. And yet there's nothing that's been published. There's no book that's been written to help older adults with ADHD. And that is my mission. That's what my book is about. And that's what this talk is about, is understanding what's going on and what can we do about it and how can we get help for ourselves if you're an older adult or for family members that you may be concerned about. So the name of my book is Still Distracted After All These Years, and I like that title a lot better than Older Adults with ADHD, which sounds awfully dreary. So here's how I went about my project. Everybody that I interviewed was a volunteer. And for that reason, I certainly am aware that I don't have a random sampling of older adults with ADHD. In fact, because people volunteered, I largely interviewed people probably a lot like you in the audience today. And that is, I interviewed older adults that were aware of ADHD, that saw my ads in Attitude Magazine, in other places, and responded. So really what my book is going to be outlining is what happens to fairly high-functioning adults with ADHD as they get older, and certainly can't be applied across the board. But it certainly is a good start, and I hope there'll be a lot more research in many different segments of the adult population. So with each person, I talk to them individually at length for at least an hour in a fairly structured telephone interview. But basically, I asked people, what I want you to tell me is, what has your journey been like? When were you diagnosed with ADHD? What was life like before your diagnosis and after your diagnosis? And what is it like for you now? And so people gave me very wonderful personal stories, personal accounts of their experience. And there was an enormous range of experiences, as you might expect. So there's been a controversy, which I think is largely a tempest in a teapot, and that is the whole issue of, is there something called late onset, adult onset of ADHD? There certainly are lots of adults and even older adults. I mean, I believe that the latest age at diagnosis among the people I interviewed was 78. So there certainly are more and more older adults getting diagnosed, but that doesn't mean that's the onset of their ADHD. In fact, far from it. And, you know, as I say here on my slide, the general consensus is that it's not adult onset, but it's delayed diagnosis. And that was true for girls and women, that there have been girls and women with ADHD forever, but they weren't getting diagnosed. They weren't being recognized. And when people in their 60s, 70s, and beyond were children, we knew very, very little about this condition we call ADHD. We mostly thought it was hyperactivity at that point, and we mostly thought it was boys, and we mostly thought it was a childhood disorder. So we knew so little about it. So it's not surprising that all these adults are coming to get a diagnosis as a middle-aged or older adult. And I talked to them about, you know, what stopped them from getting diagnosed earlier. And lots of them said, I just thought this was me. I thought this was my personality. I didn't think that this was a disorder that could be treated and changed. And of course, as I've already talked about, there was so much less awareness. of this going on. I'm in my 70s. I had a brother no longer alive who was 3 years younger, and he certainly had ADHD. But during the years he was growing up, we just knew he was very active and rambunctious and didn't like to sit down and do schoolwork, but he certainly didn't get a diagnosis and he didn't get help. And who gets overlooked depends on a lot of circumstances. As I've said earlier, females certainly have been historically overlooked, although much less so now. But there are a lot of other reasons why somebody might not be diagnosed. One of which, of course, is high IQ. In fact, to my great frustration, a lot of high IQ people that I've worked with have been told flat out by less educated mental health professionals, I can tell you right now you don't have ADHD because you have a college degree, because you have a law degree, because you run your own company, as if any sign of success means you can't possibly have ADHD. And of course, we know that's not true at all. So above average IQ allows us to compensate. Tom Brown, who was at Yale, did a lot of research on gifted college students with ADHD because that's who gets into Yale, and certainly found many with ADHD among them. But I really like one of his sayings about why does ADHD emerge later. And basically, Tom is saying that your ADHD emerges when the demands of the situation you find yourself in exceed your ability to cope with them. And so that means for some super bright people with all sorts of good verbal intelligence may go most of the way through graduate school before ADHD gets in their way. And for them, often it's the dissertation. I've had a belief for a long, long time that if you got a group of people together, none of whom were able to complete their dissertation, you would have a group of very smart, very ADHD adults. And of course, as we all know, there's the likelihood of misdiagnosis because ADHD rarely occurs by itself. Anxiety, depression, bipolar disorders, substance use disorders, eating disorders, learning disabilities. There's so many coexisting conditions, and sometimes those conditions are better understood and they're the ones that are picked up. So this is just a slide to show you that ADHD is pretty darn prevalent in the adult population, which makes it even more concerning, if not outright outrageous, that mental health professionals and neurologists are not trained in considering ADHD as a diagnosis in a middle-aged or older adult. So this is something that Dr. David Goodman talked about in his talk. He is a psychiatrist, and he talked very frankly about the amount of training that adult psychiatrists receive about adult ADHD is little to none. It might be a few hours of training out of years of specialization. And I've got the reference here for any of you that are interested in listening to Dr. Goodman's talk. So one of the things that people worry about a lot is when they get into their 60s and 70s, are we going to be more vulnerable to dementia if we've already had memory problems, organizational problems, focus problems all of our life? Does that mean it's just going to get worse and worse because we're going to develop dementia? And what we have learned in the few studies that have been done is that there really is not a greater risk of dementia. Of course, having ADHD doesn't mean you won't get Alzheimer's, but it also doesn't mean that you are likely to get Alzheimer's. And I think that is positive news that people should realize. And the thing that concerns me is that because we don't have a lot of information for older adults, many older adults and many of their spouses worry that the memory problems, the forgetfulness, is the onset of dementia, and take their spouse to a memory clinic where the only thing that's really screened for is Alzheimer's. There really is no consistent way of considering, might this be lifelong ADHD manifesting in later years? So we need to routinely screen, and I'm sorry this slide seems to be a little confusing when they put it together, different fonts. But let me just go over the highlights of this, because this is very important information. If you are an older adult or you have an older adult in the family that you think might have ADHD, then it's important to know that if you go to a memory clinic, first of all, ADHD should be considered and screened for. But I was very distressed to learn in a local memory clinic that the screener they were using was to ask the older adult, him or herself, to complete a questionnaire about how they were as a child. And I don't know very many 70 or 75-year-olds that have an accurate memory of how they were as a child. That's not at all what we should be asking them. It's so important to interview family members to find out, have these kinds of issues been going on for a long time? And also to ask family members if there are other members of the family that have been diagnosed with ADHD, because as we all know, it's highly genetic and it's more likely to be ADHD if there are children, grandchildren, siblings that have ADHD. So it's important to understand that mild cognitive impairment is different than what ADHD looks like in older adults. And mild cognitive impairment is a precursor for dementia very typically, and is something to worry about. But the thing that's so important to realize is that it's mild cognitive impairment if it's a real significant change in cognition over a short period of time, over the past year or two, rather than, yes, I've always been forgetful, absent-minded, a bit disorganized. So ADHD has always been there. And Swiss cheese memory is a term I picked up from someone else, but basically it's unpredictable memory. I can remember it easily now, but maybe not tomorrow. And then the following day, I'll be able to remember it again. Whereas cognitive decline is more often typified by very poor memory for recent events. That's not particularly true for ADHD. Of course, distractibility, misplacing things, not finishing projects, disorganization, and emotional regulation issues. And those continue. I mean, we know all about those in kids, but they continue throughout our adult years and into our later years. And a lot of the adults I talk to would say, I am impatient, I am irritable, I have difficulty controlling that impatience when I'm around other people. So one of the questions that I asked all of the adults that I interviewed is, what are the top 5 challenges related to ADHD that you experience? I was very interested in this because I'm interested in helping to develop a questionnaire, a screening questionnaire that is customized to capture the issues that are experienced by older adults. So let's take a look at what they told me. The number one challenge reported was not getting things done. And you might be surprised by this. You might be surprised because a lot of people think, well, what are you trying to get done if you're retired? Well, retirees try to get lots and lots of things done. I mean, they may have chores around the house. They may be having hobbies. They may volunteer for organizations that need them to produce information, write material. They have to keep up with their paperwork, with their complicated, increasingly complicated medical care. There's a lot of work to be done as we get older, which may surprise younger people, but it's true. And the number 2 challenge, which surprised me, was my emotions are not under control. I talked about it a minute ago, but emotional meltdowns, reactivity. I'm finding with women, they're reporting a lot more anxiety, low self-esteem, depression. With men, they're reporting more irritability, anger, impatience, sadness and regret reported by men and women. I actually have a neuropsych postdoc doing research on these top 5, and I'll be publishing our results later. Is there a difference between men and women, and exactly how did these all come out? So poor time management. And that's not surprising because with ADHD, you have trouble managing your time most of your life, but all of the mile markers, as I call them, aren't there once you're retired. There's no particular bedtime or getting up time or schedule to do. And people tell me I have no idea where the time goes. Feels to me like I've been busy all day, but I can't really tell you what I've accomplished. I get lost in things and lose track of time. I'm still always running late. And a number of women reported that this had caused a lot of social problems for them, that their running late is misinterpreted as I must not be very important to you, and losing friends over it. This is another thing that surprised me. The remnants of what I call remnants of hyperactivity, still feeling driven and restless. A lot of them saying my brain is still spinning, random thoughts going on all the time. I talk too much. I constantly overestimate what I can accomplish, take on too many things, and I'm living in chaos. And I can't seem to relax. I just need to keep going, need to keep doing. And number 5 is problems in interpersonal relationships. And interpersonal relationships are very important to keep up in our retirement years. We lose so many of the natural connections that we have during early and middle adulthood. I mean, we're not raising children. We're not meeting parents of our children on the soccer field, at various clubs and activities. We are not having the social life of work. And even though we may have had what we felt were pretty close relationships with people we worked with, it's a very common story that those relationships don't continue once we've retired. So it's so important to have good social skills and to be able to build a different kind of a social life in retirement. So people reported to me that they felt very misunderstood and judged. I would say more women feeling that than men. Many of them said, I really need to be a better listener. I drive my spouse crazy. I interrupt people. Sometimes I use the wrong tone of voice, or I'm talking too much. Several people said, I have to interrupt. I can't even remember what I wanted to say if I wait for the other person to finish. I don't feel like I fit into social groups, and I'm missing social cues all the time. And for many, their spouse is telling them that I could tell people were tired of hearing your story, but you just kept on talking, missing those social cues. So this is a very, very important topic that I'm not going to spend much time on, but super important in looking at what's going on with adults with ADHD. And that is Russell Barkley's research. And I know he has given talks about his research himself, but I wanted to put it in the context of my studies. And he found that for adults with combined type ADHD, meaning the hyperactivity and impulsivity is still there to some extent, that their life expectancy is reduced by almost 13 years. That's an incredible lifespan reduction. So if the average lifespan in the United States is 78 years, that means that people with ADHD are only living into their early 60s on average. And even if you don't have combined type, even if you have inattentive type ADHD, you're still having a lifespan reduced by more than 8 years, which tells us that very few people with ADHD live into their 70s. And one of the reasons this is so important is the little bit of population research that has been done suggests that the incidence of ADHD in older adults is only about half of that found in the general adult population. And so there was all sorts of speculation about, well, ADHD must get better in older years. Russ Barkley research is telling us it's not that their ADHD got better, it's that half of them are no longer alive by the time that they reach age 65 and beyond. So it's not getting better, it's just that there are many fewer people with ADHD alive in later years. And what is this caused by? It's caused by a lot of things. Barkley calls it low conscientiousness, inability to delay gratification. And so what does that mean, and why would that make you live less long? He's talking about conscientiousness in terms of healthy daily habits. And so people with ADHD are more likely to smoke cigarettes. They're more likely to consume unhealthy levels of alcohol. They're more likely to have obesity due to lack of exercise, because exercise requires planning and self-discipline as we get older, because of poor nutrition, because people with ADHD often, when you think about immediate gratification, well, food is immediate gratification, and especially food cooked by someone else. I can't tell you how many women say, I hate to plan meals, I hate to cook. And as we all know, carry-out food and fast food is very caloric and not terribly good for us. There are driving accidents and other accidents. Those tend to occur earlier in life. Lots of psychiatric comorbidities and just chronic stress, which takes a hold on anyone that's experienced in it and really has a negative impact on our overall health. So who does live into old age? Well, certainly inattentive type ADHD is more likely. Higher intelligence, as we talked about, better executive functioning. And that just means those that are better at daily life management in many ways. Those with more education are more likely to live into old age. And those with supportive long-term relationships. And all these make sense. If you're smart, if you're informed, if you know more about how to take good care of yourself, if you're not impulsive and therefore not accident prone, and if you have emotional support, of course, you're much more likely to live into old age. So what do? How do we treat older adults with ADHD? Well, what I tell people at every age, and at the Chesapeake Clinic, we treat people of all ages with ADHD. And I tell people that my job is to help you figure out how to get your brain to function optimally at any age. And yes, stimulant medication can improve the functioning of your brain, but it's insufficient. And for some people, it doesn't work that well. For many people, it does work well, but it doesn't make your ADHD go away. So there are a lot of other things we need to do to treat you and for you to really be able to function optimally. And one of the first things that we talk about are brain-friendly daily habits that improve health and also improve your cognition. And what do I mean by brain-friendly daily habits? We talk about sleep. There is relatively recent research that's come out that we now better understand the function of sleep, and that during certain phases of deep sleep, our brain is literally being cleansed of toxins that can become the beginning of Alzheimer's, for example, if we don't get adequate sleep. And so many people with ADHD, unfortunately, have very poor sleep habits, stay up way too late, have interrupted sleep, are napping during the day, and not taking good care of themselves in terms of sleep. Nutrition is hugely important. And by that, I mean, I always counsel people to eat a low glycemic diet, limiting starch and sugar, have protein at every meal, because that makes you have a much more level supply of glucose, which is what our brains run on. That's our brain's fuel. Stress management is hugely important. Exercise is hugely important. And so we really try to coach people and teach them to develop these habits. And they really need to become habits, not just good intentions, but habits that we do on a daily basis. And it'll make a huge positive impact on how you're impacted by ADHD. Executive function coaching is very important part of the treatment. And sometimes at Chesapeake, you will be working with a therapist who's also in many ways functioning as a coach. Problem solving, habit development, time management, money management, space management. Lots of research shows that if we live in a cluttered, chaotic space, we're going to be much less cognitively functional. And also, this is a huge problem, as I talked about a little bit earlier, but reducing social isolation. It's so important to remain connected as older adults. Our mood is better, our focus is better, we feel better. And it's the older we get, the more people in our lives we lose. So we have to take active steps to keep adding activities and people to our lives in order to stay socially connected. This is a real area that is lacking, and that is experience in treating older adults with psychostimulant medication. Yes, it helps. It helps exactly the same way it helps people at any age. Many psychiatrists, having no experience in it, are reluctant to prescribe stimulants. They're worried about the interaction between other medications, because older adults are more likely to be taking several medications. They're worried about the impact on the heart. But I'm here to tell you that among the people that I interviewed, the great majority of them are on medication, really benefiting from stimulant medication. And we need to get the message out and the training out to more psychiatrists who are willing to prescribe it. And in ways, it's quite ironic, because in geriatric medicine, it's not uncommon at all to prescribe stimulants to very old and enfeebled persons, because it wakes up their brain. It gives them more energy. It arouses them. And yet the standard psychiatrist is reluctant to prescribe stimulants to a healthy 65-year-old. We really need to do something about that. This is something I want to do more research on, but we need structure and we need social interaction as older adults with ADHD. And so one of the things that I would love to do research on is doing surveys in large older adult communities to see if there might be a higher incidence of ADHD in those communities. Those communities are designed ideally for someone with ADHD. There are all kinds of activities. You don't have to organize them. All you have to do is show up. There's a built-in social life. There's lots of structure that doesn't exist if you stay in your home in the suburbs and become more and more isolated. Working in retirement can actually be a boon for the same reason. It provides structure. It provides social contact, a place to go, a time to go, an activity to do when you get there. Of course, it gives you supplemental income. But I've worked with a number of older adults that lamented that for financial reasons they needed to work, only to later come back and say, really, it's the best thing that's happened to me. And I really enjoy my job and being around people for part of each day. So ADHD presents itself in many different ways. You can't paint them all with the same brush. And this is one thing that I found to my delight, that many of the people that I interviewed were in long-term, very positive, supportive relationships. And most of the research, most of what you read about ADHD is a very high divorce rate. So this was very surprising to me. And not all of them, but many of these long supportive marriages were second marriages, that they got married young, they got married somewhat impulsively, the marriage didn't last long, but their second marriage was a good one to a well-chosen partner. And I talked to many people that had been married for 30 or even 40 years. That's not to say that everyone is doing well, though. I mean, I interviewed quite a number of people that felt quite lonely and struggling and didn't know what to do with themselves. Said, this isn't what I envisioned in my retirement years. Many of them don't have strong family connections, or their family members live far away and they see them rarely. But there certainly are people that are struggling and feeling a lot of regret. If only I'd been diagnosed 40 years earlier, I think I would have had a very different life. On the other hand, I found people that say, this is great. I was counting the minutes until I could retire, and now I'm doing the things that I love. There's a little bit of research, and there needs to be a lot more on the connection between creativity and ADHD. I run a support group for older adults with ADHD, and over half of the people in that group have very significant artistic talent, and I don't think that's an accident. So for some, retirement is great. I can finally do it. Never happier after all these years. I interviewed some people, all of whom happen to be women. I don't know if that's a trend, that said, this is really one of the best times in my life. I don't have the pressure of work anymore. I've finished raising my children. I am integrated into my community. I'm very involved in volunteer work that is meaningful for me. And these are good times. So let me close before I answer questions by saying what I would advise to clinicians that are thinking of diagnosing or treating adults with ADHD. In terms of the diagnosis, it is so important to look at the whole extended family. It's much more likely to be ADHD. You can have much more confidence in your diagnosis if you see that there are younger family members already diagnosed. Very important to get information from adult children, spouses as well. If there is a spouse that's been around for a long time, have them complete adult ADHD questionnaires describing their parent or their spouse. And to keep in mind that ADHD is long-term, so you really need to look at factors that would be evident in earlier years. Were they really smart but ended up going to 4 different colleges? Or maybe they went to college but never graduated. Maybe they have a history of jumping from job to job throughout their adult life. So don't just look in a very myopic way at what's going on right now in the older adult's life, but get the lifespan picture and get the family picture. You'll be a lot more confident in your diagnosis. And in terms of treatment, we've talked a lot about it already, but certainly consider psychostimulants. And it may be hard for you to find someone that feels comfortable prescribing it. Interestingly, in Dr. Goodman's seminar, he was surprised to find that most of the adults attending had not had difficulty getting psychostimulants prescribed, which is very good news. I'm not sure that's true for people all over the country. Very important, if you're going to look at the anxiety and depression, which are commonly there, don't overlook the ADHD as you do it. Bring in a coach that can help build those brain healthy daily habits and just life management skills that are so critical. And if they're really struggling and lonely, encourage them to consider moving to a senior community where they're going to have more built-in social life, which is so important. So with that, I thank you, and I'm ready to take your questions and looking forward to them.
Thank you so much for that presentation, Dr. Nadeau. It gave us so much to think about. And I will say we have received 224 questions. We will not get through all the questions. I do apologize. I'm working hard to make sure that as many questions get asked and answered as humanly possible. But the really heartbreaking thing that I'm seeing in these questions is this theme of people not being taken seriously. They are seeking help, and they are hearing that, as you said, they can't possibly have ADHD because they have, X, Y, and Z. So what I'm seeing a lot is there hope? Is there a benefit to a late life diagnosis? There are a lot of people out there who do not have a formal diagnosis yet, and they're wondering if it's worth it. Can you talk about some of the benefits that come with getting a formal evaluation?
That's a great question. I think there are tremendous benefits in getting a diagnosis at any point in life, but certainly in later years. And you don't want to dismiss yourself. I mean, there is this thing called ageism. And I do hear people say, what does it matter? I mean, my gosh, you're 72 years old. Why does it matter if you have ADHD? It hugely impacts your quality of life. It makes life more stressful. It makes people feel badly about themselves. The diagnosis alone is therapeutic. And we find that at every age that, that explains everything. And we also can tell them how to restructure their life. I mean, I am a huge proponent of teaching people how to create an ADD-friendly environment at every age. And I touched on it. In this short lecture, there's not a lot of time to talk about it at length, but I think that some senior living facilities are ADD-friendly environments in that meals are provided, activities are provided, a social life is provided, which is hard to do when you're living in isolation. Right.
Yes, especially now. And we're seeing that as well in the comments. A number of people saying that, social isolation has really aggravated their symptoms and maybe even made them more aware of the fact that they do need to seek a diagnosis. So I would say the second most common, one of the other most common questions we're seeing here is just how to go about finding a doctor who specifically understands how to interpret the DSM for adults.
It's not easy. what I'm finding is that many people who started off specializing in treating children end up treating adults because the children's parents have it, and then become more comfortable treating older adults. So in the town where I live, the person that probably treats the most older adults with ADHD was a pediatrician who's treated ADHD all of his life. You have to do networking. Often I'll tell people, if you don't live in a metropolitan area where there's a good, strong ADHD specialty clinic, that it might be worth your time to get a formal assessment in such a place and then bring that formal assessment back to your primary care physician. I find that primary care physicians are a lot more comfortable prescribing stimulants if they have some guidance. And so we will actually send a letter that we've done this and this. We diagnose ADHD in adulthood. And this is the course of treatment that we recommend, and we're happy to answer any of your questions. And then that goes into their chart with their primary care physician, and often they'll be willing to prescribe it under those circumstances. They don't feel qualified to make the diagnosis, but with guidance, they're willing to offer treatment. So go to a specialist and bring that specialist diagnosis and recommendations back to care providers in your community.
And I should mention, we didn't go in too much to the DSM. There is a great piece from Dr. Barker on the Attitude website that I'll post as well, about how the DSM was written to diagnose children and how it doesn't really reflect the experiences of adults. You mentioned a lot of the most common manifestations of ADHD in adults. Some of them are not at all represented in the DSM. So it is important to find a clinician who recognizes that and kind of pivots accordingly, I guess.
It's very important. And I think that anyone who is truly expert in diagnosing ADHD does not limit themselves to the DSM in any way. There's so much controversy about it, and it's important. I've had people, and one of the reasons I'm writing this book is it will give people a book to take to their physician. Can you please read this? Because this talks all about me, and this is why I need treatment. That we're in a position of having to educate our care providers at this point, and I hope it's not true for too long.
Yes. This is more of a curiosity. I did hear from several people here who said that their doctors asked to speak to people from their childhood to trace back whether the behavior, their behaviors had begun in childhood. But is that really realistic to ask? I mean, I've never heard that before.
Well, that sounds awfully silly. Certainly, if you are in your 70s and have siblings that can say, oh my gosh, he was such a hyperactive kid, and this, that can be helpful. I think it is important to talk to family members who have known the older adult for many years. It's ridiculous to look for childhood symptoms for several reasons. One is whose memory is accurate 60 years later. But the other is that we are learning, and we keep raising the age at which you must have had symptoms before it can be ADHD. And I think we're going to continue to raise that age, that it sometimes doesn't manifest itself in the same way. If you're a girl, if you're very smart, if you have a very structured, supportive family, you're not going to ever present the classic out of control ADHD picture that people are mistakenly looking for.
Right. And that kind of leads into another common question here that we've had, which is the interaction between ADHD symptoms and menopause. And how can menopause impact your symptoms, aggravate them, estrogen levels? I know it's a big topic, but maybe just a a short overview here would be helpful for a lot of people.
It's an important topic, and it's a topic that I'm going to be a little bit sexist here because I find that it is more female psychiatrists, female physicians, female psychologists that are very aware of this link, whereas I actually formed a panel at a conference on women with ADHD, and male physicians on that panel said they'd absolutely seen no connection between menopause and ADHD. And I quietly asked myself, have you looked for any connection between menopause and ADHD? What we know is that the brain is a target organ for estrogen. We've known that forever. And what that means is that when estrogen levels fluctuate, our dopamine receptors and our serotonin receptors, which means attention, self-management, anxiety, mood disorder, are less sensitive. So, of course, those things fluctuate, and we've known about that forever. I mean, that's really what premenstrual symptoms in many ways are all about. And we also know that estrogen levels start declining on average at about age 40, and menopause on average occurs about age 50. And it's not the absolute level of estrogen, but the fact that it is declining during those years that can greatly exacerbate ADHD symptoms. So it's hugely impacted by lower estrogen levels. And, the opposite is true as well. Years ago, Patricia Quinn and I were contacted by a mother of a very ADHD daughter, teenager, had gotten herself accidentally pregnant. And the mother wrote to us that my daughter's ADHD symptoms nearly disappeared during the pregnancy. Of course, your estrogen levels are very high then and came roaring back after she had the baby. So there's all kinds of evidence that there's a huge estrogen ADHD symptom connection, and we need more people writing about it and doing research.
Right, because it just obviously complicates that diagnosis for women later in life all the more. Interesting. And I should mention there was a question here also, that men also experience fluctuating hormones, and that may in fact complicate their picture as well. Are there any good tools that you would recommend or that you use for evaluating older adults, but maybe specifically women in the age of COVID, when we are working over teletherapy? We had a question from a couple of clinicians who are wondering how they might adjust during this time.
Well, I'm not sure why we would need to adjust what we're asking because of COVID, although, and truth be told, everyone is suffering under COVID, and I think people with ADHD even more so at every age. But I think that what clinicians need to be aware of is don't rely on absolute levels. I'm a big believer in questionnaires because it's basically a structured interview so that you're sure that you've gotten information about a lot of different factors. But I'm not a great believer in a cutoff score. In fact, talking to the clinicians, I think that what we are in the very slow process of doing is changing our concept of ADHD from a categorical disorder. You have it or you don't. I mean, that's always been absurd in my mind, that if you have 5 symptoms, you don't have it. And if you have 6 symptoms, you do. I mean, that's ridiculous. It's like telling somebody you're not quite depressed enough, come back next week if you're a little more depressed and I'll give you the diagnosis. And so I think what we're going to realize is that ADHD exists along a continuum, and you can have a little or a lot, and that you can be impacted by ADHD very differently from one period of your life to another, going back to what Tom Brown said, that ADHD is manifested when we can't meet the demands of our environment. And the demands of our environment might be triplets. The demands of our environment might be our dissertation, might be a dreadful boss, might be understaffing at work, that our ADHD symptoms go up as our environment is less and less ADD friendly. So it's so important to view this flexibly and intuitively and clinically, rather than going down a checklist and saying, yes, you have it, or no, you don't.
Right. So key. Yes. If your clinician gives you a checklist, that's a red flag. Yeah.
Well, no, I'm not saying that.
I mean, all by
question all the time, but
right.
A very in-depth, detailed clinical interview is the best way to diagnose ADHD.
Yes. I want to make sure we leave time here at the end for what is probably the most common suite of questions, and that is about medication. A lot of concern about particularly people with cardiovascular disease and whether stimulants are safe for a whole population of people here feel that because of other conditions, they are not able to safely take stimulants.
And for some people, that is true. And I think it's really important. Our psychiatrists always refer to primary care or cardiologists to really get approval for prescribing stimulants. We, of course, start prescribing at very low doses. And if people have issues with pulse rate or blood pressure or anything else, we certainly are very tuned into that and don't continue with stimulant medication. There are other non-stimulant medications. And I just want to make clear to the audience, I'm a clinical psychologist. And although I have worked with people for many decades that are on medication, I'm not the medication expert to be answering detailed questions. But in my experience, a great many adults can tolerate stimulant medication and benefit from them.
Yes, actually, you just triggered a memory. I'll see if I can find it really quickly. I think there was a new piece of research that came out specifically on stimulants for older adults. I'll post that if I can find it here. But a lot of people wondering what non-medical interventions you have seen the most success with, whether it's exercise, diet, therapy, a combination of the above. But a lot of people interested in alternatives to medications for various reasons.
Absolutely. There is Alzheimer's researcher named Dale Bredesen, who has become better and better known. And I was doing research on an article a number of years ago, and I came across an article titled "The Reversal of Cognitive Decline." And you better believe that piqued my interest, reversal of cognitive decline. And what Dale Bredesen, who has been a geriatric researcher for many, many years and highly credentialed, he set about looking at all the things he could find that suggested that improved cognitive functioning. And he said it was basically like throwing spaghetti at the wall and seeing what stuck. So he had a group of formerly high-functioning adults who were struggling significantly with cognitive decline. Several of them had been forced to retire early because they couldn't any longer perform their profession, whatever it was. These were pretty high-functioning people. It was a very small cohort of 10 or 11 people. And of his cohort, all of them had significant improvement in their cognitive ability over the course of a year or two. Only one did not, and it turns out she had already fairly advanced Alzheimer's. And what he had them do was regulate just what I'm talking about, brain healthy daily habits, sleep regulation, being sure to get enough sleep, aerobic exercise, hugely important for improving cognition, a low glycemic diet, getting off, a lot of alcohol, sugar, starch, whatever, eating lots of fruits, vegetables, and protein. Mental stimulation, engaging in mental stimulation, social stimulation, getting out of social isolation. And he wrote and said not everyone perfectly followed all of this, but nevertheless, all of them showed reversal of cognitive decline, improvement in their cognition. And Dale Bredesen's protocol is now being used routinely at the Cleveland Clinic, and there's a lot of research going on. So he's not talking about ADHD specifically, but cognitive functioning generally. But I'm a huge believer in that. And when I read that article, I thought to myself, that should be the first treatment protocol for adult ADHD.
This is so fascinating. I'm so sad to say that we're already at 2:00. The time has flown by, and I feel that we could easily go on for 2 or 3 more hours. We're now up to more than 450 questions, believe it or not. So we covered a lot of ground. Thank you so much, Dr. Nadeau. This is there's just a wealth of really critically important information here today. So thank you so much for your time and such a thorough explanation.
Absolutely. And I have a question for you.
Yes.
Because it's very important and interesting to me what those questions are.
Yes.
I want to know what people want to know because, of course, I'm in the midst of writing my book, writing about what people want to know about ADHD in older adults. So I'm wondering if there's any way that these questions can be captured. And
absolutely. We will, and actually quite a few people asked to see the other questions too. So when the event is over, we get a download of all of the questions. So we will be sure to share that with you, and we'll figure out a good way maybe to condense them and add some privacy to make them available to all the attendees. We don't want to be revealing people's full names for obvious reasons.
Absolutely.
And since you mentioned it, I will also follow up your book, which is, please correct me if I'm getting this wrong, Still Distracted After All These Years.
Yes.
It is a work in progress. Yes, some people were curiously searching Amazon, so it's not yet available.
It's a work in progress. I'm actively working on it now. I've got grad students helping me crunch the numbers. I'm doing the writing, and I really hope that it's ready for publication in 6 months or so.
Wonderful. Okay. Well, I think you'll have a lot of pre-orders. And I do want to thank everyone for joining us today, and just like to thank again Dr. Nadeau, and hope that you can join us again because, boy, there is a lot to cover here on this topic.
Good. Thank you for inviting me.
Thank you so much. Have a great day, everybody.
Bye-bye.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.
So, you've got an idea for a business, the store of your dreams. There's just one thing to figure out: everything. That's why Shopify's all-in-one commerce platform makes it easy to sell online, in person, and everywhere else. Sell on social media, source products with an app to get that first sale feeling. It's the only solution that gives you everything you need to sell everywhere you want. So when you're ready to bring your idea to life, power it up with Shopify.
Sign up for a $1 per month trial period at shopify.com/listen.